Well, hi, David.
Hi Todd, how are you?
I'm good. Have you recovered from our trip to Chicago?
Not completely, but I'm getting there.
Yeah, it was, it's the American Medical Association's annual meeting, which takes place over the same weekend as the Belmont Stakes for the horse racing aficionados. Kind of curious as to your just overall impressions of the meeting.
Well, it wasn't as much fun as the Triple Crown usually is, which I've always wanted to go to all three of the races, that's on my bucket list to go to all three of the races one year. But unless you get a champion for the Triple Crown, that wouldn't be quite as exciting. But nonetheless, it was a very good meeting. It was very exciting in a lot of different ways, and one thing that our members could take away from this is the House of Medicine, represented by physicians, was all together, and they are all sharing concerns about the many things that are going on, and they are all committed to working to improve them. And so it was something that was, even though there were lots of challenges ahead, it's nice to have that feeling that you're not alone in that.
Yeah, I think that's right. I mean, I do worry that there are divisive issues that may be difficult to overcome, and whenever there have been sort of big moments, define that however you want, in healthcare, there's been a challenge in the sense that you do create, if you will, winners and losers. And so one of the real tensions that at least the meetings, that in which I participated, there was a lot of tension between physician organizations that were really focused on the Medicaid program and protecting cuts to the Medicaid program versus some of the physician organizations that were more focused on, Medicare reimbursement issues, et cetera. I think this challenge is going to be, there are subspecialties that are being pitted against each other, and you need a forum like the AMA to bring everyone together to at least be able to try to address those, which I think is the point you're making.
It is, and it was also nice to see that the AMA held to its kind of its approach to decorum and to respect for each other. And so even with those tensions, I felt that people were pretty well contained and they were really trying to focus on addressing whatever issue was being discussed that was really important. And so since we did go to some different ones, I didn't have as much as the Medicaid Medicare tension, but the Medicaid concern is pretty palpable.
Yeah, I think that was, to me, most of the meetings that I attended, that was the number one topic of discussion, and there was a lot of real concern as to, just the effect it's going to have, particularly on children, and what that's going to look like. Um, I know there were other issues. There are a lot of transplant issues. ASN sort of sits in an interesting place as we're sort of becoming, we're currently a member of what they call the Triple S. And then after this year, we'd be eligible to join the House of Delegates. The Renal Physicians Association is already a member of the House of Delegates, so we obviously work very closely with them. And then the American Society of Transplant Surgeons is also a member of the House of Delegates. And so ASN and RPA and ASTS and a couple of other organizations are part of what's called the Transplant Caucus. And there were a lot of transplant related issues that were discussed as well. And so I did feel like while there were some issues that were very unique to the AMA and some of the constituencies, in general, most of the topics that were being discussed aligned pretty well with ASN's priorities.
Yeah, and I had another one that I was going to share with you in particular. ASN sits within a coalition group that includes a lot of different people within the House of Medicine, and it's called the Dialysis Vascular Access Coalition. And then it also does some of the focus on some of the in-office services that are provided in medicine. And those have been kind of really ignored into a lot of payment issues in the last 2 decades, actually. So there was a resolution that we had participated in putting together on that, that did get reference for approval, and I'm still digging through everything to find out if exactly what happened at the end of the day Wednesday on the voting. But nonetheless, it was a very interesting conversation, and it had to do with whether certain costs in of a certain nature, in office visits really should be taken out of the physician fee schedule and done separately. So, and that was a good conversation about that, and there was a lot of other different things of that nature that we're really trying to figure out how, there's if we're talking about a lot of deregulation in this era, I think we're also going to see a lot of conversation. I'm not saying anything in particular about what ASN would do on any particular issue, but I think there's going to be a big push to decouple things that have been coupled in the last couple decades that are much more expensive and very hard to maintain unless you're in a large institution. And I did get the impression that there was a lot of effort there to make sure that smaller private practices could survive.
Yeah, I think you're putting your finger on another tension, which is difficult when you're trying to represent the entirety of physicians and physician specialties and physician organizations, both federally but also at a state level. So an organization like the American Society of Nephrology, but also the, New Mexico Medical Society. And so, I think your point is well taken. I was also struck that there was a lot more at this meeting around concerns about research funding and about the research infrastructure, particularly the National Institutes of Health, but then some of the other federal agencies. So that, the I don't want to get too wonky about the process, but they have, resolutions that then get referred to different committees, and these committees, which they call reference committees, then there's sort of a debate about it, about the resolution. And so, we were all in different reference committees, and one of the ones that I attended, there was a lot of discussion around different resolutions related, particularly to the National Institutes of Health, and I think most of those did pass without a lot of controversy.
Yeah, I noticed that when we started, and I said that there was a lot of like, shared concerns going on around the House of Medicine, including those that are in ASN, and that absolutely is one of the top ones. I think along with Medicaid, that one is a very very big deal about research um, and whether or not there is we are facing things that might really truly damage the products of science in the United States. I don't want to get inflammatory about that or something. I mean, we follow these things. We're working on these. We've supported large increases in NIH funding, and what exactly ends up happening on that, we're still waiting to see. But everybody in medicine, I think, all the physicians are very concerned about that, and they
And
do.
before we move off it, I don't want to oversimplify this discussion, but it seems like, and tell me if I'm misreading this. I mean, it's really up to the Senate. I mean, there are members of the Senate. Susan Collins will be the one I would identify as being the most vocal about this, where if two or three senators put up their hand and say, you know what, these NIH cuts are unacceptable, and we're not going to push forward the big, beautiful bill unless they are adjusted up to, historical levels, we're not moving forward. I mean, am I oversimplifying the political
No, you're not
choice they have to make?
oversimplifying
I
it.
mean, at
You're
some point we just have to say this is what needs to happen. And
Yeah.
I think that was clear at this meeting, was that the AMA and pretty much every medical society, both state societies and federal were or national, were saying, this is what we need the Senate to do, period. End of discussion.
And to add to that, I'm not going to go into anything that was said specifically in the meeting that I attended yesterday, but several of us attended it, including Dr. Suzanne Watnick with us. And in this meeting, shared some very blunt talk about vaccine decisions. But let's just say, we're all kind of struggling with that issue because we're not sure exactly where Secretary Kennedy wants to go with that. But there's a lot of concern in the Senate. You know, I mean, I'm just not sure exactly where we end up at the end of the day, but
Yeah, it's interesting you just to circle back to vaccines because, at the end of the AMA meeting was when Secretary Kennedy made the announcement about sort of firing everyone on the APIC vaccine panel. And then at the time, he hadn't announced who the replacements were going to be. But the AMA and several of the larger organizations like the American College of Physicians sort of instantly, pushed back on that. And I do think that your point is well taken, which is clearly the federal role in vaccines has now become another battleground issue that while I think we could have anticipated this at the beginning of the year, I'm struck by sort of the timing. And if I can use kind of an analogy, which has helped me try to understand it, it's surprising to me that the has opted to make public statements about dismantling FEMA right at the beginning of hurricane season. It just seems like, if you have these policy goals and you feel like you have a mandate from the voters to pursue them, you also the politics strike me that maybe you want to time it a little differently. But perhaps I'm just misreading the tea leaves as to the mood of the
No, I don't think you are. I think the administration may run the risk of maybe not really digesting what Republican senators said during the confirmation hearings. And I think they made some things that were pretty clear and important. And so and there's the White House. That's one thing here. And then there's the House, and there's some very, very, very staunch people about the deficit. And they've drawn a new line in the sand that basically says to the Senate, if you touch any of these things on the deficit reduction side, then we're not going to go for it. And it's like a 30 something group. So I mean, it would completely just upend everything. Um, just exactly how they go about that, I don't know. But the one thing about Congress is if they want to compromise, they can do pretty much anything.
hmm
They do have that authority. And so we shall see where they all end up going, and exactly how much of this is as much a big, beautiful bill as some people would like it to be. And we ASN is going to do its job, and that's, you do you lead us as the executive VP, myself and others are in policy, and our job is, regardless of a lot of things that we don't like or our members don't like, we have to try to find out as much common room as we can. And so, for example, things like NIH and so forth, we're never going to stop advocating for that. But we are trying to see what we can find, and where we can engage the administration and really encourage them to go back to their kidney agenda that they had in the first administration, which we would welcome and be very willing to work with them on that, should that end up being the case.
Yeah, I think, obviously I take my direction from the ASN Council, which is elected by the membership, and then the council has the various committees. And on the policy side, we have the four sort of policy facing committees, one that's mostly around regulatory and quality issues, one that's mostly legislative, one focused specifically on transplant, and then a fourth on inequities and disparities. And so I feel like we have the coverage between the council and the members of the expertise, and then through the committees, et cetera. And then at a staff level, we have the expertise both of sort of the substantive levels, but also sort of the process and navigating the regulatory and legislative arenas. And then we have these partnerships or these coalitions, and AMA is the one where we started today, which is the broadest. And then we have ones that are much more specific, like the Dialysis Access one you mentioned. Um, I
And
guess
and ACP that we're
yeah,
pretty
the
active
ACP
in.
we talked about, and so I think I am cautiously optimistic that the community is trying to work together, as you said at the beginning. I guess just as we end, maybe to talk a little bit about where we are in the process. So I had brought the big beautiful bill into this discussion. Um, I think just so people are clear, the Senate has two choices. They can either vote to approve what the House approved, the version the House approved, and then that would go straight to the president for his signature. Or they can vote to make changes. And I made the point about the NIH. If they make one or two changes, then it has to go into reconciliation, which is different than the reconciliation in terms of the process, where the two versions of the bill have to be reconciled by the House and Senate, and then who gets appointed to that committee from the House and the Senate to come up with something that would then go back to the House to be approved in the Senate. So there's a lot of process here, and I just want to make sure A, I summarize that correctly, and then B, I'll put you on the spot and ask you to make some sort of prediction as to what you think is going to happen between now and July 4th, which seems to be the sort of deadline for at least the president's vision of the big, beautiful bill.
Well, I will date myself by saying I always called those conference committees. Um,
Uh,
and we used to have them all the time. We hardly ever have them anymore.
yeah,
As
no.
far as, and that's a real shame, because that's both parties would assign people to the conference committees, and it was pretty good. And so, in this case, I think more along the lines of Speaker Johnson would have to work with um, his caucus in the House to come up with some agreement on whatever the Senate does. Um, I I find it hard to imagine that they will be completely finished by July 4th. We're actually getting pretty close to the end of the month, and so um, I, I find it hard to imagine that. But I think they will be at some point. I would not be surprised if the Senate had done something. It will require them to go back to the House, and that's probably what's going to be worked on. That will be probably the theme of July. But there is an anticipation that the debt ceiling will be hit somewhere in the next 2 months. Some say very soon at the end of this month. Um, but that's a big deal. And if our bond ratings and our bond yields start to really tank, and then that's a real problem for the country. It's a real problem for the world economy, not just ours. And one of the things, we talk a lot about, that the White House wants this big bill, but one of the things in the bill is raising the debt ceiling, and they can do that without any agreement from Democrats in reconciliation if Republicans come together, and they want that very badly. So I keep reminding myself that that's going to really push them to make this successful, because if they have to do a debt ceiling off the reconciliation, they're going to have to compromise with the Democrats and give them something. And they don't want to do that. And if I were them, I'm not sure I would want to either. I mean, it's just the way the whole system works. Because Democrats would ask for something that they would find painful. So that's really the key that I think may keep this thing going, is the debt ceiling and the bond yields for the federal government.
Well, David, maybe we should stop there. I mean, I think you've laid out what's likely to happen over the next couple of weeks and sort of what to pay attention to. Um, I think the next time we talk, we'll have a little bit more clarity on some of these issues. But unless there's anything else you wanted to add, I think this is a good place for us to stop today's discussion.
No, no, we're heading deep into the regulatory space of summer, so we got a lot to do, and that we'll have more things to report, and from Congress and from the administration. So this is a good place to stop.
Great. Well, thank you.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition, or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.